Welcome to this segment of Ask a Physical Therapist. My name is Jeremy Shook. I'm a physical therapist with Excel Rehab and Sports. Today we're going to be talking about frozen shoulder. Frozen shoulder is a condition in which you begin to lose mobility of a shoulder, develop painful movements within the joint, all because of either excessive scar tissue formation within the joint or the joint capsule that surrounds the joint shrinking and limiting the mobility. This can develop following an injury or a surgery in which your body produces excessive scar tissue, or many patients develop this condition with no injury at all. One of the main symptoms with this condition is limited mobility and the difficulty to be able to reach overhead or behind your back, into the back seat of the car, things like that. Pain can be associated with this condition depending on the stage that you're in. However, strength is generally not limited in any capacity with this condition. That's one of the big differentiating factors between, say, a torn rotator cuff and other conditions versus frozen shoulder. Frozen shoulder will develop more of a limited range of motion. However, strength is typically pretty good within that available range. Research suggests that patients with a history of cervical spine disorder, thyroid disorders, diabetes, or any patient who's had situations of excessive scar tissue formation following surgery are at higher risk of developing frozen shoulder. There are multiple stages of frozen shoulder, but generally speaking, frozen shoulder can be classified as either in the inflammatory stages or the scar tissue stages. And they present vastly different and they're treated vastly different depending on the stage. During the inflammatory stage, you need to be careful not to excessively stretch and develop more inflammation, which could actually make the condition a bit worse. So we recommend repeated stretching within your available range, pushing slightly into discomfort, but not pushing aggressively into discomfort during this stage. During the scar tissue phase, pain is less prevalent, and therefore you can stretch more aggressively. I recommend that you seek the consult of a physical therapist who specializes in hands-on assessment and treatment for this condition, and they can help you determine what stage your condition's in, how to best treat it, whether or not we need consult with a physician. You might need some anti-inflammatory regimens. We treat this condition commonly in conjunction with physicians so that we can help to speed up the process through the use of anti-inflammatory regimen if needed. In many states, including Tennessee, South Carolina, and other surrounding states, you do not need a physician referral. So you can come in and seek consult from one of us directly. We can offer a free consult and just give you some direction from there. If you need anything, look us up on our website, Facebook, or call one of our offices. We can set up a free consult today. Thank you.